Cardiac tamponade can be broken down. Tamponade refers to pressure, which obstructs blood flow, and cardiac refers to the heart. So in cardiac tamponade, there's a buildup of fluid in the pericardium, and that fluid puts pressure on the outside of the heart. As a result, the heart's unable to pump normally and blood flow is obstructed. Normally, the heart sits inside the pericardium, which is a pouch or cavity with two layers. The outer layer is the fibrous pericardium, and it helps keep the heart in place within the chest cavity. The inner layer of the pouch is the serous pericardium, and that includes the pericardial cavity, and is filled with a small amount of fluid that lets the heart slip around as it beats. The cells of the serous pericardium secrete and reabsorb the fluid, so usually there's no more than 50 milliliters of fluid in the pericardial cavity at any time. That's about as much as a big shot glass. A pericardial effusion is when the fluid starts to pool in the pericardial space, and it can develop into cardiac tamponade, depending on how much fluid there is and how quickly it accumulates. A rapid accumulation of fluid can happen as a result of trauma to the chest. For example, a stab wound can puncture a blood vessel and fill the pericardium with blood. Even blunt trauma, like a steering wheel getting pushed into your chest during a car crash, can lead to tamponade, because the force of the impact causes the rupture of lots of small blood vessels. Cardiac tamponade can classically happen a few days after a myocardial infarction, because the weak, infarcted ventricular wall ruptures when it's exposed to high ventricular pressures. A rare cause is heart surgery, where once again a weakened muscle can rupture and cause cardiac tamponade, days after the operation. Yet another cause is aortic dissection, which is when blood pools in the actual wall of the aorta. If the aortic dissection ruptures through the wall of the aorta and through the fibrous pericardium, blood can spill right into the pericardial cavity, leading to cardiac tamponade. In these rapid situations, even a small volume, as little as 150 milliliters, can lead to tamponade, because the pericardium doesn't have time to stretch and accommodate it. Treatment of cardiac tamponade in the acute setting is pericardiocentesis, and that's where a needle is inserted into the pericardium to drain the excess pericardial fluid. After that, the underlying disease is typically addressed. Alright, as a quick recap, cardiac tamponade is a collection of fluid inside the pericardium that puts pressure on the heart and affects its function. It frequently presents with Beck's triad, which is hypotension, distended neck veins, and distant heart sounds on auscultation. Treatment of cardiac tamponade requires an immediate pericardiocentesis, as well as management of the underlying condition.